Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker. Thank you so much for joining us. However you may be joining us, we really, really appreciate it. We're always glad to have back one of our favorite dentists, Dr. Kalisha Hanley. Dr. Kalisha, welcome back to the program.
Thank you. It's a pleasure to be here.
I appreciate that. And just so you know, dental director.
Yes.
So it's important to be a dentist, but it also talks about what's important about your role as the dental director with Tesh Action Clinic.
Exactly. It gives me a chance to oversee the different dentists at the site and just to someone to be responsible and take accountability for what's going on in dentistry there.
Well, and you know, it's one of our jobs is to make sure that we take care of our teeth, right? And to make sure that we're taking care of that. And the fact that you're overseeing everything that happens with the dental care that's being provided to those people is really important. And so I know you probably get asked the questions quite a bit about children, but you've been getting this question about when is the right time to bring my child in? And I'm so glad that you thought about talking about children's oral health, and that's really what we're going to talk about today.
Yes, that's a very popular question I get. When should I bring my baby to the dentist? Are they too young? And the answer to that is within 6 months of when they get their first tooth, they need to get a dentist appointment.
Okay.
Normally, you'll get your first tooth, it averages around 6 months. And so I will see babies between 6 months to 12 months.
Right.
But when I say that, I always have parents to call and they say that my child is 10 months and they don't have their first tooth and they're concerned.
Right.
So then I reiterate that 6 months is just the average time.
Right.
Okay. That right there does not mean the normalcy range. It's normal if your child does not get their tooth until 10 months, 11 months, or 12 months. All of that's okay.
Right. And there's so many factors that lead into that, right? Not
Yes.
everybody's the same. You can't just say at 6 months that you need to be worried, but you know, different people who have their teeth come out at different times.
Exactly. I like to tell the patients that it could be based on nutrition, genetics, congenital defects. And when we start talking about genetics and I start asking, do you know when you got your first tooth? And they start telling like, oh, well, I didn't get my teeth till late. So I tell them there is a genetic role that takes place there, but it still should be in the range of normalcy. So they no need to worry about that.
Right, some 6 to 12 months or so. So when they see the first tooth, time to schedule that dental appointment.
When you see the first tooth, you come, you get a dentist appointment, and it's not just for the patient of the child. Yes, we're going to look and make sure there are no congenital defects, but it's also an opportunity to educate the parents. It's to let the parents know, how can I make sure that I'm giving my child the best oral care possible? And that starts with even before they have teeth. When they just have their gums, using a damp gauze or a damp washcloth and wiping off those gums after they drink their milk. It starts very early on what you can do to start having good oral health care.
And so sometimes mothers or fathers that want to just find out more information, even before the tooth comes out, schedule your dental appointment.
Yes.
Come in, we'll do a gum appointment.
Yes, it's about patient education. And even though that the baby is young, the parents, that we're also aiming towards you to educate you about what you need to do for your children.
Wow. And speaking of, there's a number of different things that affect babies' oral health, like tooth eruption.
Yes. So when we talked about how the different ages, there's a normalcy range. So even though the average is 6 months, the normalcy range can go all the way up to 12, 13, 14, 15 months. And especially depending on the parent's background. And so what I tell them is to look for signs of teething. When you start seeing signs that your child is starting to drool more, you notice that they may have a temperature, they're starting to chew on different things, you start noticing little red spots on their gums when you're wiping them off, those are the areas that a tooth is most likely going to erupt in. And so when I talk to them about teething, and they're like, oh, well, even though I don't see a tooth, I have started seeing these signs. It gives them some relief.
Right, because they don't think that something's wrong. They know that tooth eruption is normal. And teething is one of those ways to be able to identify that's a normal process for what's coming next.
Yes. With the teething, I tell them that it's the process that the infants go through when the gums are breaking through the teeth. And so I always let them know what they can do in the meantime to try to soothe them is to give them a teething ring and refrigerate it, never freeze it.
Only refrigerate.
Only refrigerate
Want
it.
it cold, not frozen.
Right.
Okay.
Because the coolness will be soothing to their gums. And if you don't have a teething ring, you can always let them chew on some raw fruits like an apple. they will find that soothing.
They'll find that soothing. Okay. Now, they can have some problems if they have this baby bottle for too long. Tell us a little bit about baby bottle syndrome, which I don't think a lot of people know about.
Yes. So with the baby bottle syndrome, it's very, very important parents know because it's a common cause of caries, cavities on the front of the teeth.
Okay.
It's from sleeping with bottles, having that juice, that milk, formula, anything sweet inside that bottle that's constantly being on the teeth. And when I say constantly, I'm talking about frequency and prolonged exposure.
Okay.
That's the number one thing that I try to educate parents on because you see it across the front teeth. And if the baby is sleeping with the bottle and they can grab it at any time of the day or night and just be sipping on it throughout the day when you could be having your snacks and your meals, but you find yourself always holding on to the bottle and using it like a pacifier when they're fussy, it's too much prolonged exposure. And that's what comes with baby bottle syndrome.
And I like the picture, it kind of shares the problems that people can develop with that, some of those cavities that they can develop at the very front of the teeth.
Yes.
Because there's always that liquid or that juice or something sweet that's always right there as they're sucking on it. So we don't want to leave their bottle with them. We want to give them a pacifier, and we're going to talk about that a little bit later, but in the next segment. But that's what can happen if you allow them to have their bottle all the time.
Yes.
That frequency and duration.
Yes.
How often you give it to them and how long they keep it or keep it in their mouth.
Very good.
Okay. I'm listening. I'm learning. So if I happen, this is for me with grandchildren at some point down the road that we want to be able to do. But some really good information that I think that people don't always think about, or they have questions but they don't know what to do or who to ask. So you've answered a lot of those questions for people before they even need to do that. And a lot of questions get asked to a lot of the dentists who report to you about babies' oral health. And we talked a little bit about it last segment, but is there anything you wanted to add about that?
Well, with the baby bottle syndrome or early childhood caries, it's such a big deal because we see it so often.
Okay.
So I just want parents to know that when you're getting the child ready for bed, and I know that some people love for them to have a bottle, use water. Let's just try to cut back on the sugar. It's the sugar that mixes with our bacteria in the mouth that causes the acid that breaks down those teeth. So start using water as substitutes for the children when they're going to bed, when they're going to sleep.
Yeah. So if they are going to have that bottle and they're going to do it for some time, let's put that picture back up if you don't mind, for baby bottle syndrome, and just let you know what you can expect if you have something sweet in that bottle. And notice that one's full. And so it's really interesting. So if they go to bed and that bottle is full, they may suck on that all night long, and it comforts them, and that's what the nipple is there on the bottle for, is to comfort them. But if it's got something sweet in it, it can create these problems, and we don't want to have upper tooth decay for babies and children that young.
Exactly.
Because that can just create so many more problems down the road.
Exactly.
Okay, very good. And so that's just one of those things. So if you're going to do it and you really want your baby to have a bottle at night, water is the best way to go.
Water is the best way to go.
Very good. And so people just need to kind of be aware of that and a way to do that. And so we appreciate that and all the specifics about what teething is and how people know and when the tooth eruption is going to come out, and just being aware of that. And good gum health, and they can bring their baby in as soon as they would like, to be able to identify what to do and expect that. And so massaging their gums, and there's some things that are very healthy to do with that. They can also be more aware of when that tooth is coming out because they can feel it.
Yes, yes. So I like for them to know about the eruption, know about the teething, know what to expect.
Right.
And the other thing is that the parents need to know what their role is.
Gotcha.
And that right there is going to habits that they need to outgrow.
Okay.
And there we start with the bottle.
Right.
So about time they're about 12 months of age, that's a good age to start weaning from the bottle. They don't have to be completely weaned off, but start going in that direction, so ideally by 18 months.
Okay.
Because
so
the longer
12 to 18 month range.
12 to 18 months.
Okay.
Because the longer they get attached to the bottle, the harder it's going to be to wean. And you don't want it to start hindering speech development.
And that can make a difference. The best way to get them off of the bottle is by?
Best way to get them off the bottle, substitute the bottle when they're fussy for a pacifier. Pacifiers do great because we don't have to worry about the baby bottle syndrome. And the only thing with pacifiers, because again, everything has a time limit. About time they're 2 years of age, and this is for pacifiers and thumb sucking.
Both of those.
You should start weaning them off, limiting that when they start 2. And about time they're 4 years of age, it needs to totally be eliminated.
And so we've got a little bit of a timeline there, right?
Yes.
We're looking at the 12 to 18 month range to get off that bottle, but you've got that 2 year to 4 year range that you want to get them off of the pacifier thumb sucking. That's some good timeline to be able to do that.
It's because every child is different. Some children will just naturally, like they're tired of the pacifiers, but some will hold on. Some children are still sucking on their thumb. But the thing that you have to keep in mind as a parent is that at this point, your jaws and teeth can be affected. So when they're sucking on that pacifier, when they're sucking on that thumb, that's pressure and force going against those teeth. That's realigning the palate of their mouth, their bone, and that tooth structure, causing their teeth to flare out. Now you have open bite. And that's when their mouth is closed, the teeth are together, but your front teeth don't touch. This right here changes the way they bite, it affects the way they speak, and it's going to start affecting them confidence in the social arena.
And this is what that looks like. And so that open bite syndrome is here, and it is caused from pacifiers for too long and thumb sucking for too long. And so I know that sometimes parents are like, oh, I don't want to take them away from that. They're not going to be my baby anymore. And so we hear some of those things, right? But this is the problem with that. It really manipulates the structure of the mouth. And this is a good example of what it does with open bite syndrome.
Yes. And so I tell parents there are things that we can do when they're not using it. Start doing positive reinforcement. Start giving rewards, anything to try to wean them off. As far as wean them, you can start by just doing it when they're fussy, then in nap time, then only bedtime, and then all together remove it together.
Wow. Very good. And just, again, it's that timing of when you do that. Take them off of that, and then, about 2 years of age, if they really you still see that they're really wanting the pacifier, especially the thumb sucking, because that's one of those behaviors that they can do on their own. You can control taking the pacifier away, but thumb sucking is one of those things that they do on their own. We want to find ways to do that. How do we help them no longer thumb suck?
So with thumb sucking, first, you have to give them praise when they're not doing it.
Okay.
A lot of times you find out that they're doing it, maybe they're anxious or fearful. So we have to kind of get to know our child and see what makes it do it. Do they do it when it's bedtime? Do they do it when they're upset or scared? And then we have to substitute it with a better coping mechanism, whether that's a binky, a teddy bear, a blanket.
Okay.
And if it really gets bad, if they're really starting to get around 4 years of age, then go to the dentist. They'll probably try to get an appliance for them to wear.
An appliance, right. And so we want to try behavior modification.
Yes.
We want to change their behavior by modifying the environment.
Exactly.
Okay. Little social work history there.
I noticed
a little
that.
psychology
I like
that I've learned a little bit. But that's what you do, and that's how people, because I think people are afraid to do that. Like, oh, I don't want to, but they need to know what the repercussions are for their child and subsequently for their relationship with that parent down the road. We're talking a little bit about some of the things that parents can do and some of the things that we need to be aware of. But the way to protect permanent teeth is something really important to your practice.
Yes, and I let parents know that protecting the permanent teeth, you have to be very proactive in it.
Okay.
So around 6 years of age, your child is going to start getting their first permanent teeth in the back.
Okay.
These are the molars, and
Right.
these are the ones that you're going to do the chewing and the grinding on. So the best way to protect them is to get sealants.
Okay.
We recommend sealants for all of your permanent teeth, the molars and the premolars, the teeth that are doing the chewing. It's a plastic covering that goes right on top of the chewing area of the tooth that protects it from the cavities and foods getting trapped in the grooves.
And so it's something that probably we've learned over the years. When I was a child, it wasn't an option that we did this when I was 6. But it's one of those areas where we've identified and we've learned over the years, this is where the cavities can be most identified and most prevalent. And so these sealants are a way to protect those permanent teeth from having those cavities.
Exactly. When you look at the tooth, it's easy to brush and clean the sides and the smooth surfaces. But when
Right.
you look on top of the tooth and you see all those grooves and fissures and pits, it's hard to get down in between there. So placing the sealant is the way of covering that area so it can prevent food from getting trapped inside those grooves and the wrinkles of the teeth and keep it clean and cavity free.
Wow. And some of the things that we've seen for people that have had cavities when they're really younger, some of the cavities they put in years and years ago, we're starting to see problems with people as they get older. This is a way to really protect those permanent teeth of your children so they're not going to have those problems down the road.
Yes. And it's easy, it's painless, and it's a really quick procedure.
It's simple.
Very
That's
simple.
Really nice.
Yes.
So it's a really big deal to make sure. So again, about age 6, when we're starting to see those first permanent teeth.
Yes.
Again, so we've got these timelines we're talking about.
A lot of
Before that first
timelines.
tooth comes out, even if you wanted some gum health, you can go in very early. Before your child is 6 months old, identifying what to do between that 12 to 18-month age, that 18-month age to 2 to 4 years old about what to do. And now at 6, we see what we can do about those permanent teeth. And so it's a timeline that we need to be aware of about when to come in and when to take care of things and establish with one of the great dentists that work with you over at Tesh Action.
Very good. Yes, yes.
And so not only do we want to protect those, but let's talk about those space maintainers a little bit, because the spacing of the teeth is very important as we get older.
Yes. So space maintainers go again with being proactive in protecting your permanent teeth. So many times children will lose their teeth prematurely, whether it's being from an infection or cavity, or if it's just being because the tooth got knocked out while you're playing. If any of your back teeth get knocked out while you're playing, then it's important that the space is maintained.
Okay.
Once the tooth is removed, the dentist will put an appliance there to hold that space, because you don't want the side teeth to start drifting in that space. The space maintainer's goal is to keep that space secure for that future permanent teeth to grow in straight. Without that space maintainer, the permanent tooth will grow in crooked and get misaligned. And then you're starting to talk about crowding and the teeth and the occlusion getting off the bite.
And all of those things can create some tremendous problems down the road. It's why it's so important to maintain those teeth and keep them straight. And the best way to do it is with the space maintainer.
Yes, with the space maintainer. I've seen a lot of cases where parents did not realize that there was a need for space maintainers. They saw that, oh, well, if tooth got knocked out, and they figure it's just the baby teeth, what would it hurt? And then when the permanent teeth grows in crooked or out of alignment, then we have to talk about orthodontics. Now we have to talk about braces and retainers and ways of straightening the teeth. So it will not only save money, but save time. If a tooth comes out prematurely, go to the dentist. It's not about the baby tooth that came out. It's about the permanent tooth that's going to grow in.
Because these teeth are going to move backwards toward that back area if there's not enough space to keep them straight. They will naturally just go to that area that's less crowded, if you will.
The path of least resistance. They're going to go where there's space. Exactly.
And so we need to be able to do that and protect that. And so you've seen quite a bit of that. These and again, identifying these before they become a problem. Protecting the permanent teeth means that we need to be aware of what happens with the baby teeth.
Yes, yes.
So keep watching for those.
Always watch. A lot of the patients always think that the baby teeth, oh, it's not a big deal. They're going to fall out anyway. But how you treat your baby teeth can affect your permanent teeth. I always like to remind patients that.
Okay, and again, so we got about a minute left here in this segment. Let's kind of just think about a recap about what we've talked about here in these last 3 segments.
Yes, so the important things is that around 6 months of age, whenever the child gets their first tooth, it's time to go to the dentist.
Yes, ma'am.
It's time for the parents to get educated. I want parents to know, do not let your babies go to sleep with the bottle. Do not let them always carry it around throughout the day. We do not want baby bottle syndrome.
Right.
Also, make sure thumb sucking pacifiers, when they get around 2 years of age, it's time to start weaning.
Weaning them off.
Yes. And when those permanent teeth start erupting around 6 years of age, make sure you get your sealants to protect them. If you lose a tooth prematurely, make sure you have a space maintainer.
Wow. And I don't know that I've seen anybody be able to go through the timeline that we just talked about for the last 20 minutes now and recap that so very beautifully. But it's important to know what to do with your child, because their teeth is your responsibility.
Exactly.
And getting them to brush their teeth as they get older, getting them to take care of their teeth is part of that responsibility, but managing their teeth when it's their temporary teeth is important, and knowing what to do to protect the permanent teeth is also very important. All right, very good. Now I can be a good grandpa now, and I know how to be able to do that.
Very good,
Dr.
yes.
I can't thank you enough for coming on and share that with us. We appreciate it.
It's been a pleasure.
All right, we'll see you next time. All right, thank you so much for joining us. Don't go anywhere. A lot more local programming when we continue.